Thank you for joining us today for our seminar in the Journey to Science series at Onondaga Community College. The seminar is sponsored by the Bridges to Baccalaureate grant. Today we're welcoming Lisa GreenMills. Lisa graduated from OCC in 2008 with a degree in math and science and then went on to earn a Bachelor's of Nursing from SUNY Binghamton and a Master's in Public Health from SUNY Albany. Lisa started her career in public health working in a program for pregnant women and their families, and most recently, she worked as part of the team overseeing Onondaga County's COVID-19 response. She's currently preparing for her next adventure in science, which will take her to Syracuse University as the Director of Operations at the Barnes Center at SU, the health center / gym / counseling center. As you're watching Lisa's talk, if you have any questions at all, there's a Q&A button at the top, and you can submit your questions at any time, and we will cover them at the end. Lisa, thank you for sharing your time and your story with us. Welcome.
Thank you. All right, thank you so much, and welcome everybody. I'm excited that I was invited to come and give this talk today. Share a little bit about myself and my background, with Bridges students, with other students, and just see if there's anything useful that y'all can glean from me. So first, I'll do a little introduction. I want to talk about just some of my, identities and how I see myself, because I think that might help if anyone has any other, might help connect and see that there's things that we have in common. So I'm from Syracuse. I went to ESM high school. My mom was in the Army Reserves, and she was deployed when I was an undergrad. It was soon after 9/11. So she was deployed when I was an undergrad. I'm biracial. I'm part of the LGBTQ community. I have a son. I have an 8-year-old son, and my partner also has an 8-year-old son. So we have 2 very rambunctious children in the house. I just spent 7 years with the Onondaga County Health Department. That was my most recent position. And like it was mentioned, I started out there as a program coordinator for a program for pregnant women. And then most recently, I've been director of disease control throughout the first phases of the COVID-19 pandemic. And so next week on Monday, I'm going to be starting in a position up at SU. And I'm excited because I've actually had 2 weeks off in between, which, when you're in school, you have these long breaks, you have summer, you have spring breaks. When you start working, you have nothing. It's just straight through till the end. But I was able to get 2 weeks off in between. I'm super excited. Some of my hobbies, that I like to do that I have not really made any time for, and I don't recommend getting yourself so busy that you don't do your hobbies anymore. But I like to weave, I like to sew. I've always been into meditation, but again, I don't make enough time for that. So I'm going to walk you through kind of the steps that I took to get where I am today, like some of my academic and professional life progress. So when I was in high school, I was miserable. I hated it. I was very, very unhappy. And I was working with my guidance counselors. I found a way that I could graduate actually at the end of 11th grade. We just kind of jam-packed everything together, figured out what was required and what was not required, and I was able to get out, which was a goal of mine because I was very, not feeling it there. So the first thing that I did was I went to this college in Vermont. It was for sustainable agriculture, and I was there for a semester and I dropped out. And then I decided that I wanted to go to nursing school, but I didn't have, since I left high school early, I hadn't taken chemistry. So there were certain classes that I had to take before I could get into a nursing school. So I went to OCC for 1 semester. I did the prereqs for nursing school. Then I went to nursing school at SUNY Alfred, for a semester and a half, and I dropped out probably like 3 weeks into my second semester. At that point I was like, I don't know what I want to do with my life, but it was definitely not that. I hadn't been happy in high school. I wasn't happy then. Like, I just really didn't know what I wanted. So I dropped out altogether. It terrified my parents. I think they were worried that, there goes my future. Like, I'm not going to be able to, do a lot of things now that I've just dropped out so many times and kind of floating for a while. So the first thing that I did was I went and lived on this farm and retreat center. It was a place where they had like a work exchange program. So you could live there in exchange for working 20 hours a week on their farm. And it was also like a meditation place, which is where I first learned about meditation. So I lived there for about a year, just doing a work exchange. And then some friends of mine from there were moving down to Florida for this other, meditation program. So I moved down to Florida for a couple months. I worked at a grocery store there, and I did a meditation program down there. And then while I was at the first place, I had applied for AmeriCorps. I don't know if everyone's familiar with AmeriCorps, but it's like a volunteer program. It's the one that I did. It was a year long. It was right after Hurricane Katrina, so we were down in New Orleans, Louisiana, Mississippi area, working on gutting houses, so houses that had been flooded, emptying them out, and then building houses for people to live in. And so while I was there, I'll tell you a story. There was one night we were out, of course, none of us were of age, but we were out on Bourbon Street, and my friend got mugged, like he got beat up. So we called an ambulance, and it was like not too long after Hurricane Katrina, so there was not really, like the hospital system was not back up and running 100% yet. So I remember I went with him in the ambulance, and we were like, I was in the back, and I could hear the people in the front trying to figure out where are we supposed to park? Where are we supposed to back in? Like they didn't even, it was so much chaos and confusion. They didn't even know where to go. So finally we get to the hospital, which is Lord and Taylor, I think. And it had been gutted out, and they had, tents, and they had just kind of done like a temporary pop-up hospital in there. So he was there overnight, and I stayed with him. And I got to see all throughout the night, like all these nurses and doctors working, and they literally had nothing. Like he didn't even have a pillow. There was no blankets. Everything was in tents, like on concrete in this gutted out department store. It was crazy. But when I was looking around, I was like, oh my God, like this is so cool. So I was like, I do want to go be a nurse. I was like, I want to go back. So even though, my parents were so worried that because I had stepped away from nursing school one time, that it meant I was like done with that forever and would never, have that chance again. At that point, I was like, you know what? I do want to do it. And I think by then I had enough life experience to realize it was worth it, that like putting that effort in and everything was going to be worth it for me. So I came back home. AmeriCorps ended. It was about a year. I came to OCC. I was in the math and science program. And while I was there, I was just super active and engaged. I think because I knew, because I just had a little bit more time to figure out what I was about or what I wanted to do. When I came back, I really had this sense of direction. So I participated in the Bridges program. I did an internship at Binghamton University. I was part of Phi Theta Kappa and C-Step. I mean, I was down in the C-Step office like constantly. So I just took advantage of all the resources that were there and, tried to learn everything that I can. And then when I did the Bridges program at Binghamton, I was like, oh, I really like Binghamton. So then I was able to get into the nursing program there. So while I was in the nursing program at Binghamton, my mom had worked at the VA. Like I said, she's a vet. So she had been working at the VA, and I was able to get a job at the VA as like a nurse's aide, more or less. So I was working at the VA, and then in the summer in between the two, because I did 2 years at Binghamton, in the summer in between those two, I had the opportunity to go down to the NIH in Bethesda, Maryland, and I did a summer internship there. And I think having done the Bridges program the year before gave me like all this, excitement around research and feeling like, oh, I can do this. So then to get that internship at the NIH was just huge. I was like so excited about that. So I did my internship down at the NIH. And between those two things though, working at the VA and doing the internship at the NIH, I again sort of had a little change of heart, and I was like, I don't really like patient care. Like I loved, there were certain aspects of healthcare that I loved, but patient care wasn't like where I wanted to be. And I think I had felt a lot of, pressure and direction to go into clinical care, that be a doctor, be a nurse, like, do this kind of like direct clinical care. But really there is a ton more out there. If that is something that sort of calls to you, but not 100%, you have so many options. So after I was done at Binghamton, rather than going straight into the workforce, I went on for a master's in public health at SUNY Albany. So when I was there, I had a graduate research assistantship. So I was working with one of the professors there, and she was doing community-based research. So what we were focused on was childhood obesity and Head Start programs. So we would go out to the Head Start programs, work with the families. We came up with a program that we were pilot testing to try to combat childhood obesity in that setting. And then the summer in between, I did an internship at the Onondaga County Health Department, here in Syracuse, where I was working for the Healthy Start program. So that's where I kind of got my first foot into the health department here and learning about, what was going on in Onondaga County. So I graduated with my master's. I was pregnant when I graduated, so I didn't work right away because I was just like very pregnant. So I was home for a bit. I had him. I was home for 6 months with him, which was awesome. It's not an opportunity that a lot of people get. It was partially by necessity because I just didn't have a job. But it was also just super nice to be able to spend the first 6 months with him. So my first job after that was I was working as a nurse in a pediatrician's office, and it was a nurse/research tech position. So they were participating in this national study on like pilot testing a new medication. So part of my role was just working with patients, doing the normal kind of working in a doctor's office as a nurse stuff. And then I also worked with Sarepta oh my God, I'm not gonna be able to pronounce it, therapeuticals, whatever it is, coordinating the research that they were doing at that site. So while I was there, the person who I had interned for at the health department previously, she actually got a promotion, and so her position was open. So I applied for that, and I think since they knew me, since I had done the internship there, and I'd already kind of met a lot of the people and worked within that setting, I was offered that position, and I was there for 5 years. I absolutely loved it. It was community-oriented work. It was focusing on reproductive health care in communities of color, which is something that was like very, present for me at that moment, because my son was still little. He was like, I don't know, he wasn't even a year yet. So it was just, it was work that was meaningful. I loved it. I loved the team that I was working with. And then around like 4 years of doing that, I started feeling like, you know what, maybe I want to do something else. Or I did everything that I could do here. I made my mark here and I want to do something else. So I was at the county, so I started taking civil service tests just for other positions, try to see what else was out there. And then a position opened up for director of disease control. And I had actually taken the test and was like on the list for the position. So it was going to be a huge, leap for me. And I turned it down. I was like, yeah, no. I was like, I really like this community work. I don't want to be back in the clinic again, because the director of disease control position at that point was focused on tuberculosis and STD clinic, and then things like rabies and hepatitis A. And I was just like, yeah, I don't think that's for me. I don't really want to do it. But then my friends kind of talked me into it, like, you got this, this is the next step for you. How often in your career, after just 5 years in one position, are you going to be able to be director, like get this huge, leap, in your career? So I was like, all right. So I took it, and I was working as director of disease control, doing kind of the normal stuff like STDs and tuberculosis for about 1.5 years. And then, of course, COVID hit. So that position took on a whole nother sort of meaning and path. And during that year, so I was there for about a year. I just left, like I said, a week ago. So I was there for about a year, and it was basically building everything from the ground up. It was a brand new global pandemic. It basically shut down the world. Businesses, schools, everything was kind of just shut down to deal with it. And then, the health departments and the hospitals were all still just hustling and like going in every day trying to figure out how to combat this thing. And like I said, we really had to like, everything that came up, we had to solve it as it came up. So in the beginning, it was nursing homes. Like all of a sudden we were seeing all this spread in nursing homes. So then we had to figure out, okay, what are we going to do about that piece? And then in the summer, we were seeing it in some daycares or that type of setting. So we had to figure out, okay, what do we do when it's in a daycare setting? And then it was in the colleges. We were trying to figure, okay, what do we do? There's COVID up at SU, there's COVID at Lemoyne. Like, what are we going to do about this? There's COVID in a bus driver, COVID in a surgeon. Like, how do we handle each of those things and try to combat it? And then at the same time, CDC was coming out with new guidance, the state was coming out with new guidance. So we were always trying to keep up with what was changing. and at the same time actually like run the response. So just deal with the day-to-day issues of, people calling frustrated because they're on quarantine and they don't think they should be, or vice versa, people calling because they were exposed and nobody had called them. So it was a lot of just logistics and organization and, on the fly training and systems development. And there was a huge, component related to the data around it. So trying to figure out, okay, where are we seeing spread right now? There was one time where, on 4th of July, we were seeing spread from parties. So trying to track down these parties and who was there, it was like detective work. It was super interesting, but also very, very draining and productive of burnout. So after almost a year of that, I think it was about 9-10 months of the COVID response, that I was just like, yeah, this is not working for me. This is not working for my family. It was like 14-hour days, working on the weekends. So I felt a lot of guilt, stepping away from that. But sometimes you gotta put your family, you gotta put your mental health, you gotta put all these other things first, and just have faith in your team that, even if things change and you're gonna leave a certain workplace, know that that team is gonna be fine and they're gonna carry on, and that you have to try to set systems in place so that they can be successful even, in your absence. And they'll find, I'm confident they'll find somebody great to fill those shoes. So that's kind of been my journey. And up next for me, I'm going to be Director of Operations at the Barnes Center at Syracuse University. So that's starting next Monday. I'm really excited about that position and just kind of seeing, I know that there'll be some COVID involvement there for sure. But I'm excited to just be in a different setting and like get to know new coworkers and new processes and, just kind of branch out and see what I can do. So that's my background. But one thing that I wanted to talk a little bit about was, because I know probably most people listening in are in the STEM careers or STEM tracks. And I want everyone to know that, there's always a lot of enthusiasm around like clinical work, like medical clinical work, and also lab type work, so research in a lab. And I just want you to know that there are tons of other, like if that's your jam, that's awesome, but there are tons of other things that you can do. So I wanted to talk about how STEM careers fit into the public health field, if that's something that you're interested in. So the reasons I love public health is because it kind of combines that clinical research side of things, but it's also grounded in the community. So if you're someone who's really like, community issues are up for you, it's something that you're thinking about and you're, volunteering places and participating in things, public health might be a career that you want to look at because it combines your STEM background with that community organizing and that type of work. And, you never get bored, every day is different, and you never have any question if the work that you're doing is making a difference because you can see like, here's somebody who's pregnant who a week ago didn't have prenatal care and now we've been able to connect her. Or here's, a family where the dad and the 2 kids have COVID and the grandma is sick and we were able to get her in a hotel. Like you can see that difference directly. So it's just a really rewarding field. So within it, there's a lot of different things that you can do. So if you are drawn to medicine, at the health department, we had a medical director. So the commissioner and the medical director both were physicians. So a physician in the field of public health would be looking at things like communicable diseases, so obviously now COVID, but also hepatitis, tuberculosis, STDs. There's public health nurses, so if you're on that clinical track as well as a nurse, we had tons of public health nurses at the health department. Their role was providing community education, operating the walk-in clinic that we had, doing home visits. We had a mobile cancer screening van, so they were out in the community doing cancer screenings and talking to people. So there's those kind of roles if your career path is going to be a nurse. Also for engineers, we had environmental health engineers at the health department. So they focused on things like water safety. So if you ever got a boil water alert, it was coming from those folks. Mosquito trapping and spraying, like I don't know a lot of details about how that all works, but I know there was like a whole department that focused on going out into the field and like trapping and counting and analyzing diseases of mosquitoes and then putting alerts out to the public and, spraying chemicals if there was like high rates of mosquitoes in certain areas. The engineers also did the restaurant inspections, and they dealt with like animal bites. So if there was bats and things like that that people had, they were like, dissecting the bats and trying to figure out if they had rabies or not. So there's still sort of that like clinical laboratory side of things for public health engineers. And then for data people, for people who are in the math side of it, there's epidemiology, which is looking for trends in for us, it was mostly around communicable disease. So for COVID, trying to figure out, where were we seeing spread happening most? What are the infection sources? What communities are hardest hit? And then making sure that we tailor our work. The epidemiologist would say, this population is being really hard hit. And then the public health nurses would go out and work with that population. So the data people and the frontline people just have to be kind of working together. And then there was research techs, which was more like the entry level position that could kind of lead up to epidemiology eventually. And that the research techs focused a lot on grants. So if we had grants that were about a certain issue, grants focused on infant mortality or tobacco usage or something, they would be analyzing data. So looking into hospital data sets or state data sets and trying to pick out the trends. And then also report to our funders saying, okay, our target was that we wanted to decrease smoking by 20%, and we decreased it by 18.5%, but here's the reasons why. So there was a whole data team that was also kind of backing up the other folks at the health department. So that's kind of an overview of the ways that you could use a STEM training in a public health career, if that's something that you're interested in. And then I wanted to close with, I've got a couple like random little pieces of advice or things that I wish people had told me or things that they did tell me, and I'm glad that they did, that I wanted to share with you. So first, if you are, you're starting out your career, you're in school now, but if you have plans at some point that you want to kind of, wherever you are, that you want to go up the ladder, like you might start as frontline or you might start as entry level, but at some point you'd like to be a director, you'd like to have, a higher level position. Think about it now and start taking management classes, because that's one thing that I felt like I was lacking a little bit in school. I took, science, I took math, I took all my nursing classes, my public health classes, but I didn't have a ton of management classes. And there's like a saying in the hospital that the best nurses don't always make the best nurse managers. So you might be killing it as a clinician or killing it as a lab tech, you're doing an awesome job at what you're doing, your technical skills are right on point. But if you can't also manage a team and figure out a budget, then it's going to be a disadvantage for you. So when you're in school and you have the opportunity, even if you're I don't want to do management, you don't have to get an MBA or anything, but I would definitely recommend taking a few management and budget type of classes, because that's going to help you, 5 or 6 years in, when you start feeling okay, I'm ready for the next step. I want to be the director of this program rather than just, staff for it. The other thing is for internships. I mean, obviously this is sponsored through the Bridges program. So hopefully people who are listening in have, are doing, about to do internships or have done internships, but I think take advantage of those. I've been on both sides now. So I've done internships and I've also taken interns. I've had interns work with me. And after being on both sides, one thing that I've seen is that, sometimes on an internship, you might get bored or something, you did your project and you still have 3 weeks left and there's nothing really left for you to do. So just ask to shadow, because it might be mundane things. For me, I went to some budget meetings and different committees and random things. My project was done, but I was can I just go with you to that meeting? So then I just started going to different meetings and seeing, okay, how do places like these function? And I think that honestly, that's what made me an attractive candidate to come back for that coordinator position at the health department. Because when I'd been an intern, even though there was no good reason for me to, I was just can I go to that meeting? Can I go to that meeting? So then I just started trying to meet everybody and figure out how things functioned. And while you're there at your internships, if you're kind of a shy person or a little bit of a quiet person, make sure that you identify somebody there as a reference and get their personal contacts before you leave. Because I've had references where I know their work email or their phone number or whatever, but then they leave that position and I can't find them. And I'm like, oh, I had a good, like this person could say good things about me, but I have no idea how to find them. And they're not on Facebook, like I just couldn't find people. So get their personal contact information before you leave your internship, and then just keep in touch. Like I've had interns who have worked for me that will send me like, randomly once a year or something, hey, I just got this new job, or oh, I got married, we have a kid now, like just sending random little updates about their life or whatever. And then it made me remember them. And then 3 years later, they're like, oh, I'm applying for a job at the CDC. Can you be a reference? And I'm like, yeah, because I remember this person from 4 years ago. So even after you leave an internship and you're like, a couple of years into some other job, still keep in touch with those people because they can be a reference for you. And then also, if you're in a position and you start feeling unhappy, so for me in the most recent one, the Director of Disease Control position, I was like, just realizing that it was overwhelming and it was not really a good fit for me. And I think once you start feeling like that, immediately start putting feelers out. So talk to the people that you did internships. You don't have to do it like, announcing anything, but just start talking to people about it, because that's how I found this position. So kind of getting the information out there, like, oh, I'm open to other things. If you have anything, send it along. And do that before you get to the point where you're like sitting in your car crying about your life. Like, if you're just a little unhappy, start reaching out to people, because it can take months, to, once you get kind of further along in your career and you get kind of into a market, that there's a specific thing that you do and, you're not so generic anymore. It could take you months to find a job that's going to be the right next step for you. So as soon as you start thinking, maybe 6 months down the line, maybe a year down the line, I'd like to make a change. At that point, start talking to your friends, talking to people that you did internships with, joining committees or like getting on a board or something. Just go out and do other things so that you start just kind of quietly getting it out there that if there's opportunities, please let you know. And then on a completely unrelated note, money stuff. Nobody ever taught me about money stuff. So I won't pretend that I'm like an expert on that. But I graduated from OCC, I think it was in 2008, which was like, the stock market crash or whatever, the crisis time. And I didn't have money. Like I was like a college student, I had no money. But if I had invested like $100 then, I probably would have had like 500 from that now. So even if, if you've got like 40 extra bucks because you didn't go out to dinner this week or whatever, find a way to just invest it, because that is something that I think a lot of us just don't think about. I didn't start thinking about it until I had a job where I was like a little more comfortable with my salary. But even when you're starting out, just like think about it now. If you have 40 bucks, there's, mutual funds or something that you can set up, and you can throw in 20 bucks or 40 bucks when you have it and just not think about it. And then years later, you look and you're like, oh, I got like $4,000 in there, just kind of is an awesome feeling. And then sort of the last thing I wanted to say was, as a person of color or as a new grad, like someone who's kind of young coming into the workforce, I had a mentor who her sort of catchphrase, or like what she was always talking about, was that, we might come in, she worked specifically with women of color. So her thing was that you might come in as the unexpected leader, like you come to the table and people think that you're there to take minutes, or that you're like the intern, or that you're dropping something off, and you're like, oh no, like it does, I hate to say it, but it does kind of catch people off guard, I think. Seeing like a young woman of color, even, I'm sure there's like all sorts of people on this call, but there might be something in your life that makes people not expect that you would be the one, who's going to be like shaking things up around there. So you do have to work a little bit extra hard, like you do, you have to be like, can I go to this meeting that there's no reason really for you to be there? Because then you get that seat at the table. Even if the first time you're there, you're just sitting in the back, maybe you are taking minutes, but then you just keep showing up and you keep going and you keep talking to different people. And afterwards you ask questions. You got to be humble about it, but like persistent. I think it's easy to kind of get stopped somewhere and say, okay, this is as far as you're going to go. All right. But just keep pushing, just keep kind of inviting yourself to the next level. If nobody else is inviting you, just keep persistent with it. And I think that has been one of the biggest things for me that's kind of helped me to get where I am now, is even when people have like, I've just felt a little bit of pushback, or like, I don't know, like people think I'm too young, or like whatever it was, just to keep showing up and keep pushing and keep showing them what you can do. And eventually you're going to get to a point where they don't even question it. And they're going to come to you and they're going to be like, what should we do about this? What should we do about that? And then you can say, oh, you should give me a promotion. But you know, it's like you can get there. I think you just, you start where you're at now. Like, you start with your internships, you start with your education. And then once you get into the workforce, you just keep pushing. Yeah. And it's fine if your path meanders. Like mine, like I was saying before, I dropped out of school like multiple times. I lived on a farm. I just had a very random life for a while, but you can come back from anything. All right, that's all I have. Thank you guys. I think there's probably questions.
Well, thank you so much, Lisa, for sharing all of that. Wow, there's a lot in there that I had no idea. The farm, the meditating, the overnight in the New Orleans Lord and Taylor turned hospital. Wow. One thing that immediately caught my attention was internships. Yes. And you did several. What role do you think those played in getting you where you are today? If you hadn't done those internships, do you think you would be where you are right now?
Oh, definitely not. I feel like it was all practice, sort of, like, being able to do bridges first let me do NIH. And then doing NIH made it that when I applied to grad school, I was able to get the assistantship there. And then doing the internship at the health department, got me connected with the directors and the commissioner and everybody there. Like I said, I always kind of like was, weaseling my way up however I could. But yeah, having those opportunities, like if I hadn't done them, then my resume would have just been one, out of 70 people applying for a job. Like there would have been nothing that stood out or made them think anything special of me. But for them to be able to see, oh wow, she worked at NIH, or oh, she did this. And even if your internships are like random, like they might not be exactly what you want to do. When I did bridges, it was studying ethanol and like mice. So we were like injecting mice, and they were doing a swim test. Like it was interesting, but it was like totally random. I did not start the summer thinking I would love to study the effects of ethanol on mice when they're swimming in a bucket. Like it would, you wouldn't think that. But then doing it was like, okay, now I see how, the way that you track data, even if this isn't data that I ever want to track again, just to see this is how they track data, and this is how they set up an experiment. And this is, the steps you have to go through with it wasn't IRB because it was animals, but like the steps you had to go through to get approval. So even if you're like, well, there's nothing out there that's exactly what I want to do, just do something that's close, because then at least you'll get, even if it's not the exact field you want to be in, those steps are something that you can use in a different field.
Wow. So that theme of, if there's no opportunity, find one, make one.
Yeah.
And when you're there, take advantage of everything that's there. I did a couple of internships. I would have never thought to ask to go to a budget meeting, because who cares about money? But right. You are so right. And definitely moving forward, as I advise students through their academics at OCC, I'll definitely throw that in there. Do you ever think you'll be in management? Let's find you a class that might appeal to that, or that might set you up on that path. Now, on a sort of, and this is always a tough question to ask, but looking back, is there anything where you're like, oh, that was a mistake, right? Nope, I wish I hadn't. It's hard to do because you are where you are now, right? You can't change anything specific, but is there anything where you're like, oh yeah, I would do that differently?
I think like staffing stuff. So I'm a very like bleeding heart, if someone's got something going on in their life, I'm like, oh my God, I'm so sorry. What can I do to make it better? And as a manager or like a director or a boss of people, sometimes you have to like not 100% be so soft and accommodating. And so there were several times as a supervisor or director that I kind of like let things slide with staff, with employees, that I should have been more strict about. And I think that's part of the thing of like, you can be a great nurse and a great scientist, but if you don't know how to manage a team, then your team's going to fall apart. so the people who are working hard are going to be upset at the people who aren't working hard, and you got to manage those like relationships and roles and hold people accountable, and you don't really learn that. Like you kind of learn it through trial and error. So I think there was some error there for me and people that I worked with, and just the way I handled some like personnel and staffing things that I probably would have done a little bit differently. But I had literally no like mentors or guidance. Like I knew nothing about how do you lead a team, and then how do you deal with team problems.
Yeah, they don't include that in the science classes usually.
No.
Now, what struck me was OCC was not your first or even second attempt at college, and you were not, and would today also not be, the only student who comes to OCC in that position. So let's say we have a student, and you know we see them every day, shows up at OCC, maybe a little bit older, maybe has gone to college in the past, has a career right now that they're not happy with. What would you say to them? You're sitting down with this person. What do you say to them?
I would say that it's awesome that they made that step to come to OCC. Like, number one, kudos for even getting there, because there's so many people who I think are just unhappy in their careers and just, you know, will do that for the next 30 years and not take any kind of step to make a change. So number one, just like a huge pat on the back for even getting to that step, because that's a huge leap to, you know, to call the school, to enroll, to navigate, you know, the paperwork and financial aid or whatever you have to do to get in. So first off, just like huge congratulations for doing all of that. And then next, I would say just, you know, if you're working already or like you have kids, you got a lot of obligations already, I think there's tons of opportunities to do stuff, you know, evenings or weekends. So just try to find, like, don't get discouraged by anything. Just try to find the way that's going to work for you. So maybe you can't do full time, or maybe you can. But just figure out, like, work with the advisors and, you know, go every day, check in, see if this new class starting, or this thing's going to be online, or there's going to be, you know, a 2-week rapid version of the class offered. You know, there's just all these opportunities that you have to like keep coming in and asking about in order to find them.
So keep at it. Don't give up, which perhaps a call to all the introverts out there, step out. Any parting words for our students?
I would say just like you've been saying, just really keep at it. And then also you know, within limitations, like within moderation, because I kept at it to the point that I was sitting in my car in the mornings crying, like miserable about going into work. So keep at it, but realize, you know, there's a point when you need to stop keeping at it and you need to draw the line and say, you know, this is where I go, do something else. So be persistent, but also like be realistic. So check in with your limits, and if something's not for you, free and clear, walk away, figure something else out. It'll work itself out.
Well, thank you for those parting words, Lisa. Now, thank you again so much for taking the time to be with us today and share your amazing story. For those of you watching live, I will drop a link in the chat for you to fill out a survey if you would like. And if you are so inclined, you can join us for our next seminar. Next, we will welcome Austin Lamika on February 17th. Austin graduated from SUNY ESF after attending OCC, and he is currently working on a master's in forest economics at North Carolina State. And again, that will be live on February 17th. Thank you and goodbye.